Okay, thank you, Tracy. 5:25 is your time. You know, while braces, of course, look adorable on a middle schooler, adults sometimes dread the thought, but what if your teeth are crooked, and do you have options to straighten them out? Because health matters. We are joined now by dentist Steve Mangan to find out a little bit more about some procedures that you do and applications. Thanks for joining us this morning.
Thank you for having me.
I know that confidence really comes from a good smile, and
You're
so
right.
many adults would love to, they just don't want to deal with the braces.
One of the biggest things that we have to deal with as dentists is that an adult might come in and say, I just really hate having crooked teeth, but I'm not going to deal with braces right now. You know, they don't want to have to go as an adult looking in something that kind of reminds them of a real teen or immature look, and so they'll say, well, what can I do? And we have several options that we like to be able to present to our patients, and one of them is to do veneers and crowns. That's one option. And then the other option, if that's not appropriate, is to do orthodontics using Invisalign, which can straighten your teeth without having to actually see the wires and the brackets. And so one of the things that you have to choose is, well, okay, which one is appropriate for that patient? Well, we have, I have a graphic, I don't know if the producers have got it up there, but the first shot, this is a case of someone who would be really perfect for crown and bridge, because you can see, yeah, those teeth are crooked, but they're also misshapen, and they've got a lot of other issues, colors that are not the same, and so you can see on the second picture that a case like that can all of a sudden be perfectly straight and very white. Same patient, and the nice thing is that is a 2-visit procedure. The first time we completed the entire upper arch, and the second visit we did the entire lower arch, and they got those in a day, so they never really spent any time with any temporaries in. And then, you know, some other cases, let's go to the next picture, and you'll see that when you've got really crooked teeth like you see in this picture, well, you could put a veneer to make those straight, but imagine how thick they would have to be to make them all in line, so they would be really terrible. So if you go to the next shot, you'll see that a case like this can be straightened out, and the fourth picture you'll see is a case of them all being straight with Invisalign. And it's really nice to see that they didn't have to walk around with wires and brackets and everything. And you know, several others that we could go through, but some cases are great for veneers and crowns. Some cases are great for Invisalign, and you can do all of that without having to have braces.
Great options. Thank you so much, Dr. Steve Mangan, for joining us. It's wonderful to know there are so many options so that you can have a great smile. We'll be back with more news and weather. Stay with us.